Hello classmates. Health and welfare continues to be two contentious issues. However, the duty of providing healthcare and welfare continues to be firmly in the hands of federal and state governments. One of the most important functions of government is protecting public health. Public health is the area of medicine that deals with the protection and improvement of citizen health and hygiene through government agencies. And one of the ongoing arguments in American politics is over how much and how best to help the poor. Many conservative politicians argue giving people handouts such as true welfare only enables them to remain stuck in poverty. So the goal today is to look at one issue of contention between the federal and state government in regards to Medicaid, to see what has been tried before and to make recommendations for improvement of intergovernmental cooperation. Here is an outline of what is being discussed in this presentation. What is Medicaid, the history of Medicaid and its cost, the purpose of Medicaid expansion, an area of contention between federal and state government regarding a specific issue in health and welfare, what has been tried so far, and recommendations for possible resolution and improvement of intergovernmental cooperation, and the conclusion. What is Medicaid? Medicaid is basically the joint state-federal health insurance program for low-income mothers and children, the elderly, and people with disabilities. Authorized by Title 19 of the Social Security Act, Medicaid was signed into law in 1965 alongside Medicare. All states, the District of Columbia, and the U.S. territories have Medicaid programs designed to provide health care coverage for low-income people. Although the federal government establishes certain parameters for all states to follow, each state administers their Medicaid program differently, resulting in variations in Medicaid coverage across the country. Here's a presentation of Medicaid costs for fiscal year 2017, which is from October 1st, 2016 to September 30th, 2017. The federal government paid out almost $355 trillion, and the state paid out an approximate $222 trillion, totaling almost $577 trillion. The purpose of Medicaid expansion. Traditional Medicaid eligibility varies by state, but it is generally limited to low-income children, women, older adults, and people with disabilities who receive supplemental security income. On the other hand, the Affordable Care Act allows states to expand Medicaid eligibility, the process is referred to as Medicaid expansion, to uninsured adults and children whose incomes are at or below 138% of the federal poverty level, including many who live with mental illness. Not every state has opted to expand Medicaid, leaving many people living with mental illness without access to affordable health insurance. So the issue is funding of Medicaid. Medicaid eats up a sizable percentage of state budgets. Republican governors and legislators argue that the goal should be to make the program more efficient instead of bigger. Some states are skeptical that the federal government would not pay its promised share, as it wouldn't be the first time Washington started a program and then left the states to make up the difference when funding is dropped. They believed in the end the track record of the federal government has been to pull away from their commitments to the states. In fact, while the federal government is attempting to expand health insurance to tens of millions of additional Americans, many states' inclination has been to cut back to save money. So what has been tried so far? Insurers Allow parents to keep their children on their plans up until age 26. Secondly, loosen Medicaid coverage if people fail to comply with the work requirements in Arkansas. Governor Nathan Deal stated, "I'm not interested in growing entitlements. I'm interested in real economic developments where Georgians are better equipped to provide for themselves and their families rather than having to rely on government welfare programs like Medicaid." And lastly, Republican Governor Sam Brownback refused to implement the Medicaid expansion and to also cut the state's TANF caseload by about a third through eligibility benefits. Rather than giving poor people a pittance, he said government should prod them into finding work. My recommendation is that all states should accept the expansion of Medicaid. There are pros and cons to every condition, but I believe the advantages will outweigh the disadvantages with health care. In addition, we can't afford to leave mental illness untreated. In conclusion, the United States' high uninsured rate has negative consequences for uninsured Americans who experience greater financial insecurity, barriers to care, and odds of poor health and preventable death. For the healthcare system, which was burdened with billions of dollars in uncompensated care, and also for the U.S. economy, which suffered, for example, because workers were concerned about joining the ranks of the uninsured if they sought additional education or started a business. Healthcare costs affect the economy, the federal budget, and virtually every American family's financial well-being. Health insurance enables children to excel at school, adults to work more productively, and Americans of all ages to live longer, healthier lives. Healthcare and welfare is a necessity, not a choice. I've come to the end of my presentation. Thank you so much for listening and reading, and please post your comments on the discussion board. Thank you again.